Welcome back to the program. This is a real crisis in New South Wales at the moment. Doctors are concerned. What is the material effect of some 200 psychiatrists already essentially quitting or walking off the job?
Well, it's an absolute body blow, Laura, to a system that's in almost terminal decline, you could say. Back 30 years ago, we closed the old mental hospitals and got rid of thousands of beds and shoehorned the what was left of the mental health system into acute hospitals, and it's been in this process of steady decline since then across Australia, in all state governments actually, and they have not actually nurtured or built the system fit for purpose so that Australians can get access to expert mental health care in a compassionate and effective way. And this is just the final turn of the screw. We've had a third of these positions vacant in New South Wales, propped up by band-aids and locums for years, and now finally hit the wall. The psychiatrists are the worst paid out of all the hospital specialists. They're paid worse than in other states, but it's almost like it's the same problem in every state, actually. So this is
Wow.
just the final straw in a way, and I don't think the government really understand how serious the problem is.
Pat, when you're looking at these crises in New South Wales, and I know you said it is right around the country, but New South Wales is probably a little bit worse because they're paid less. What is the material effect? I mean, you don't become a psychiatrist for the money. You come, there's a cause there, and there's a vocation where you do want to help seriously mentally ill people. But what kind of jobs are they doing in the public health system? Because I would assume that they're emergencies. They're in crisis situations.
Yeah, well, these psychiatrists are the best of the best. They have hung around in the public system despite the poor conditions and the lack of respect paid to them by their colleagues and by the government and the system for years. So they are very vocationally driven, and they're being forced out in a way. The work they do has got steadily more difficult over the years because it's all ambulances at the bottom of the cliff, as you say, because the public community mental health system has been just eroding and disappearing for a long time. That was the proposition that needed to be built if you were going to close all those mental hospitals, but it was never built. So everything collapses into the acute, pointy end of the system. And people are treated, in very extreme situations, and it's very hard to do a good job when people are so seriously and acutely ill. And they're just patched up and thrown back out of the street before they're really recovered. So the situation is a disgrace, actually, not just in New South Wales, but across the country. We had a Royal Commission in Victoria, as you know, which Daniel Andrews admitted that the system was broken and they said it had to be totally rebuilt. Well, that's what has to happen across the whole of Australia, and the federal government needs to come much more strongly into this picture because they've also neglected very seriously over.
They have. I mean, budget after budget, we talk about this. It's an election year, so hopefully that can change and we can get it on the agenda. But Pat, I just wanted to finally ask you about the material effect here of psychiatrists in the public system being underpaid. How much, what is the pay disparity between psychiatrists in the public and the private system? And I would say, do we risk good mental health care being only the domain of those who can afford it? Or I say that we're thinking that the ship has already sailed on that almost, hasn't it?
Yes, that's been the case for a long time. It's very inequitable, the private system. And the interesting thing is that these psychiatrists do have another option. The government haven't really understood the fact that they can actually go somewhere else and still continue to practice and make a lot more money, as you say. But the people who are really going to suffer out of this are the public, the ordinary people who cannot get safe and effective mental health care. That affects every Australian family. And even the private system, as even affluent people know, is not fit for purpose either. So I think Australians need to wake up to the fact that they are getting a really raw deal from governments on mental health. It's chalk and cheese between cancer care, for example, or NDIS care and mental health care. And that is completely unnecessary. It's weakening the country, and it's something that could be solved very quickly if governments got real.
Well, we're going to hear from Rose Jackson at around 11 a.m. Let's hope there is a breakthrough here in New South Wales. Pat, we always appreciate your time, especially today.
Thank you, Laura. Well, I think Rose is a very intelligent minister. She needs a lot more from her Premier and from the rest of her cabinet to solve this problem.
Well said. And from the federal government too. Pat, we'll see you soon.
Thank you, Laura.